A gastroscopy is an endoscopy camera test examination of the esophagus, stomach and duodenum. It can be abbreviated to the term OGD, which a lot of doctors use as another name for gastroscopy. Its function is to look at the esophagus, to look at the stomach, look at the duodenum, look at problems such as reflux, which can cause inflammation of the esophagus called reflux esophagitis. That may be associated with a hiatus hernia. Patients suffering with those would get symptoms such as acid reflux and a nasty taste coming into their mouths, particularly when they lie flat, as the acid comes back out of the stomach and back up the esophagus into the mouth. So that's a common problem that we encounter. Patients can have stomach inflammation such as gastritis or stomach ulcers or duodenal ulcers. That commonly presents with pain just under the breastbone, usually in the middle of the abdomen, so just at the top in the midline underneath the breastbone. So those are the most common reasons for performing a gastroscopy. It can be done either with sedation for patients that would prefer a bit of sedative so they're a bit sleepy. It's not a general anaesthetic, but it's a sedative so the patient does feel comfortable and relaxed and sedated to a degree. So it can either be performed with sedation or without sedation. Without sedation, you get some local anaesthetic throat spray into the back of the mouth, which makes the back of the throat go numb. The camera's about the width of my little finger. You would lie on your side in the endoscopy room. You would have a guard put into your mouth just so your teeth can't damage the gastroscope, and then given the sedation or not given the sedation, the camera would go over the back of your tongue to the back of your throat. You give a little swallow and then it goes down into the esophagus and then from there into the stomach and then from there into the duodenum. The whole process takes about 5 minutes. It's a quick procedure. If you have sedation, that would take about an hour to wear off following the procedure, so you'd be kept in under the observation of the nurses for an hour before you go home. If you don't have sedation, you could go home pretty much immediately after the procedure taking place. We tend to take photographs as we go along to prove that we've got through the esophagus, through the stomach, into the duodenum, so there'd be photographic evidence of that. We would take photographs of any pathology we saw, such as an ulcer or a hiatus hernia or any inflammation. We would also take a test usually for a bacteria called Helicobacter pylori, usually abbreviated to H. pylori, which is a bacteria associated with a lot of stomach and duodenal ulcers and gastric inflammation. And if that test is found to be positive and you get the result within an hour of your gastroscopy, you could be given a week's course of eradication antibiotics to get rid of Helicobacter pylori and help alleviate your symptoms and cure you of your condition, whether that's gastritis or an ulcer.